connect.
So now is it live or not yet?
We are live, sir.
Now we are live. So let me repeat once again. So I welcome Dr. Asmal Basak, who will be taking over for me in just a few days' time. And I think it is his responsibility to take this project forward. And he has been very supportive of everything I wanted to do during my tenure. And we are on the same page for almost everything. There has been no controversy and confusion among ourselves. So we have taken each one into the confidence before starting this project. So what I was talking that this problem is most of the time under the carpet and they don't surface because whenever the girl has got any problem, and so the family support is also lacking at that time. Most of the parents want that the girl should carry on with the same family, and with the not so strong financial position becomes very difficult for the girl to come out of the difficult situation. It takes many years. By that time, there are a lot of psychological trauma takes place. So with that in mind, so we wanted at least there should be somebody who can keep you psychologically healthy. And many times you just want to talk to somebody, there is nobody to actually listen to you. So with that in mind, we had Aarti Anand, which I had a personal experience of. She's a very good counselor and a clinical psychologist. And many times if you need just even the advice whether you should go to the court or not, if you want to go to the court or not, with that we had the lawyer on the board. So with this in mind, the idea was that you should be able to approach and the privacy should be maintained at the top level. This is what is the responsibility of this committee, that if any girl wants to talk to you and wants to go and wants to do anything, we like to maintain full privacy as far as possible. And the AIOS has got enough of a strength to finance all these activities. And with the way now we have got more or less 75% of the females coming into the ophthalmology, and still, so far as the private centers are concerned, most of the private centers are still controlled by the men as compared to the women. And if you see the major centers across the country, so some of the females, if they are feel any harassment at a workplace, we had one senior agent, she was being harassed by one of the doctors in Delhi. She left that place where she was working and joined Gangaram Hospital, and he sent him a notice from a lawyer that you are demeaning our center by leaving, and I need 1 crore of compensation. So then she was totally lost to the words. She didn't know. Then she talked to me. I said, you just write to us and we'll take care of everything. So many times they should know that there's somebody is there who can really take care of them. And we want to really give that confidence. So the job of this committee will be to popularize this activity of the AIOS, which will take some time, and encourage the people to come out and really speak out. So with this, now I hand over the responsibility to Samar Basak if he wants to say something.
Yes, thank you, Mohita, for including me in this forum. And it is an initiative. And what Harbans Lal has said, that I fully agree upon it. While I was analyzing the data of last 7 years, you know that the women ophthalmologist has increasing tremendously. It is 7,000 versus now close to 6,000 versus 3,000 figures. It's 67% versus 33% in favor of women ophthalmologists. And you see the overall data. Overall data says that men ophthalmologists are 52% now and female ophthalmologists. So within 3-4 years, the women ophthalmologists will be overcome. But not only in the family, but also in the workplace. And also I have suggested the scientific committee chairperson that that rights for the women participants also. So that should have 50-50 participation in the conference and podium presence also. So there are a lot of things work family, and other issues are there. So it is a nice initiative by the Women Ophthalmology Society. Thank you.
Santosh, you want to say a few words?
I just want to congratulate you for taking this up, sir, and Mohita, of course, for working on this cause. I think we already have a cause, conviction, and of course, confidence and courage to take it forward. Summer, I'm sure, will very adequately support it. I think we should go ahead with full spirit.
Thank you, Santosh. I think now we hand over the mic to Mohita to take it forward.
Dr. Ikeda can start the proceedings.
Thank you for a nice introduction, and thank you for forming this society where it is easily accessible for women and they can come up and discuss different issues that they are facing here with us. So we will begin this session. First talk will be by Dr. Mohita, and she has been very actively involved in WAS. She has taken WAS to new levels and really helped a lot of women ophthalmologists in their career. So it will be great to hear her insights and how she feels about this. So Dr. Mohita, can we please have your talk, please?
Thank you. Thank you so much, Dr. Ikeda. So welcome to everybody, all the AIOS members to this webinar. We all as women ophthalmologists are professionals and we put in our best foot forwards for whatever work we do. Yet we face certain workplace challenges and certain challenges which are inherent to being a woman, for which we sometimes feel isolated because all these challenges get compounded when we feel that there's an isolation and there's nobody to tell us how to overcome these challenges. So here is this committee of All India Ophthalmological Society, which is here to give you a hearing and to give you solutions. So I would like to thank All India Ophthalmological Society, especially the president, Dr. Harbans Lal, for initiating this idea. I would like to thank Dr. Samar Basak, the incoming president, and I'm sure he will take this forwards along with our ex-president, Dr. Harbans Lal. And I would like to thank Dr. Santosh Ranawat, the General Secretary of AIOS, for making this initiative possible. So here today, I will just share an action plan of what this, in brief, of what this committee plans to do. So before that, let us look at this slide. This is a very recent survey by Johnson & Johnson in December 2023, published in Ophthalmology Management, because many a times there are a lot of men as well as women ophthalmologists. When we ask them, they feel that there are no separate challenges for women. So this is what this survey results said. 11% of women ophthalmologists said that faculty or staff or fellow students were disrespectful or harassed them. 32% of women ophthalmologists said that patients disrespected or harassed them. 32% said that their competence in ophthalmology was questioned due to their gender. And 66% said that their professional ophthalmology experience would have been better if they received mentorship from other women ophthalmologists, and especially the women ophthalmologists, which means the same gender. So this slide sums up a few things, and it tells us that there are actually challenges. And along with that, there are women ophthalmologists are looking for some kind of a mentorship to overcome these challenges. And this committee is actually going to take this forwards. And just let's look at American Academy of Ophthalmology 2018, INET, what they said. They said that in 30 plus, now in American Academy of Ophthalmology, there is a separate code of ethics for all ophthalmologists, and especially a separate code of ethics for how to behave with your women colleagues. So, and they are actually supposed to do a 2 weeks training also on this, and they get certified. So in a 30 plus years of Academy's code of ethics, there has never been an ethics challenge involving alleged harassment or misconduct involving patients, colleagues, or staff for women ophthalmologists. However, surveys of female physicians in multiple specialties suggest that a large percentage of women physicians have personally experienced what they perceive to be harassment, including sexual, verbal, as well as physical, from their physician colleagues. And one study of 1066 physicians revealed that 30% of women said that they had directly experienced harassment in their careers versus 4% men, which means that this kind of challenge exists for women ophthalmologists. But the sad part is that it does not reach the societies. If it did not reach American Academy of Ophthalmology, it also means that it is not reaching All India Ophthalmological Society. So this is what this committee plans to do. The whole aim of this committee is that you are no longer alone in your professional journey. There is now a go-to place, and this go-to place is called Women Redressal Committee of All India Ophthalmological Society. So soon you will receive an email, and this email, in this email, you can share whatever challenge you may have. And this would be an absolutely private and confidential, which means it will not be shared anywhere. You can rest assured, because this is one of the biggest challenges which all women ophthalmologists feel, because they feel that if they share this challenge, it comes out in open, then it is possible that they may be penalized for this. So in this committee, there are advisors, which will be both men and women. There is a psychologist and there is a lawyer also. So finally, ending by saying that you are not alone in your professional journey, and this committee is there for you. Thank you so much.
Personal as well as professional. Professional as well as personal. I mean, if you need anything
yes,
personal also, this committee will be able to take care of that.
Yes. The advisors can advise on personal also, because what all starts from personal and it becomes professional, because that's both combined if you're especially if you're a woman.
Thank you, ma'am. Thank you for that great introductory slides on telling us how to go forward and giving direction and telling everybody of what this committee is going to do. And next, I'm going to talk about the women ophthalmologists, and is it really a challenge for them? Do they face challenges in their workplace?
So till you share the slides, I would like to introduce Dr. Ikeda Lal. Dr. Ikeda Lal is a young women ophthalmologist doing very well in a very short span of time. She has made a name for herself, and she is one person who's a role model and example of personal and professional, both balanced, and yet doing very well.
Thank you so much, ma'am, for that kind introduction. So I will be talking about workplace challenges for women ophthalmologists. Is it really an entity? Is it different for men and women? And how I'm going to begin this talk is by discussing different aspects of our career and our ophthalmology training. So we'll start with residency and training. Are there challenges faced by women in each of these aspects? Once we finish our training, are there challenges faced in pursuing our work, gender differences at work? And then what is the patient perception regarding women ophthalmologists, and what exactly is the reality? So if we look at this data, which was a large data set collected from US between 2011 to 2019, and this only looks at the ophthalmology applicants. Lesser number of women applied in ophthalmology, that is 35.3%, but a significant more number of them had matched as residents in ophthalmology. So as Dr. Basak said, that slowly the number of women ophthalmologists has been increasing in ophthalmology. But in this analysis, they found only 21% were actually AAO members. Now, since women ophthalmologists have been increasing, but how is the training? Is there actually a difference when we are looking at surgical training between men and women ophthalmologists? So this is a retrospective review conducted by Royal Australian and New Zealand College of Ophthalmologists between 2008 to 2020. And it is quite surprising that in this review, they found that female trainees completed 41.7% fewer cataract surgeries at the end as compared to their male counterparts. And this gap was lesser when they started their training and increased at 4 years of training. So this again is a concerning data, because if the training is inadequate, then it puts more challenges for us during our career. So next, we will move on to what are the challenges faced by women during work. So this is a AIOS survey, which was conducted between 529 women ophthalmologists who participated over 48 hours. This is published by Dr. Mohita Sharma in 2023. And so we have to keep in mind, although, that these women who were surveyed in this survey are probably more proactive and more academically oriented. So this may not represent the true data of ophthalmologists in the country. So in this survey, 43.2% women said that marriage did not affect their career. 21.8% women said that due to getting married, they were unable to pursue their specialty and fellowship, although 62.9% pursued fellowship, which I think is a good percentage of women. 15.9% women faced travel restrictions due to family constrictions. And although a small number, but still very significant, 1.5% women had stopped working. So this is the data of which we have, the recent data in 2023. And from the same paper, the other aspect that is challenging is breaks in career for women ophthalmologists. So here, women ophthalmologists were asked whether break in career affected their long-term career in ophthalmology. And 49% felt that yes, a break in the career affected their growth in their profession. And 27% of women did not take any breaks. And then if we look at mothers, purely only the women who are mothers, 79.5% of mothers felt that motherhood had put a temporary pause to the career, and this duration was about 10.5 months on an average. So this is another challenge that women face, and they need to get back into work, get back to the training, and need support at that point of time, need mentorship when they need to get back to work after bearing a child. Now, this is an AIOS survey which looked at practice profile of men and women in India. And what this survey found was there were larger number of male ophthalmologists who worked for more than 9 hours as compared to female ophthalmologists. So there was difference in work hours between men and women ophthalmologists. And more women ophthalmologists, double the percentage of men, that is 25.9%, felt that they restricted or curtailed their work for family needs. And in this survey, 12.4% of women faced cultural or gender bias at work, as opposed to 5.4% men. And although both of them significantly felt, approximately 55.8% and 45.9% felt that their profession was rewarding, and that's how they perceived their profession. So this again is a challenge, because the work hours and the challenges faced by women ophthalmologists at home need to be addressed. Although the good thing here was that 66.9% women felt that there was no difference in the payment between men and women ophthalmologists. And this is a little different from US data, where they did feel that there was the women were paid a little lesser than men. And 29% of women indulge in business management. This is again data from the Women Ophthalmologist Survey, which was published in 2023. Now, this is very interesting. Once women have overcome all these challenges and get to work, how do patients perceive women ophthalmologists, especially as surgeons? So this was data which was collected from 100 patients, and they were asked whom they would prefer, a male or a female ophthalmologist. And here, interestingly, for regular checkup, there was no preference. But if we look at vitreoretinal surgery, or we look at complicated cases, more patients felt that they were comfortable with male ophthalmologists as opposed to female. And the reason given was they felt that males were more confident and more equipped with handling more complicated cases, whereas females were more patient and were better suited for pediatric ophthalmology. So now, is this really true? Is it true as surgeons that there is a difference if we look at the outcomes between men and women as surgeons? So this is a very interesting data which was conducted on a large cohort of patients. These are including all surgeons, not just ophthalmologists, and they looked at long-term post-operative outcomes. And here, interestingly, all the cases were matched in terms of complexity, as well as the number of cases that were given to men and women. And here, what they found was that the adverse events actually were slightly lesser for female surgeons as compared to men. And this difference increased at the end of 1 year. So they compared at 90 days at 1 year. So there is a need to change this perception between patients as well, how they perceive women as surgeons. And this becomes very, very important, and a challenge that a lot of women face in their day-to-day work, whereas especially when they are working along with a male ophthalmologist or a senior male ophthalmologist, this can be very challenging, that patients might feel that they want to get operated by the male ophthalmologist as compared to a female. So to conclude, women ophthalmologists are more likely to take breaks in their career and restrict the hours at work. And we need to re-empower them because they need a delicate work-life balance, which is essential to achieve success and lead a fulfilling life. Thank you.
Thank you so much, Ikeda. That was a beautiful presentation. Getting many facts
Actually,
out.
Mohita, one important thing, even
Yes.
the people may laugh at the way the women drive, but the women cause much less accident as compared to the men in their drives. And same is true for the surgeries also, because they play it safe and they are at ease. So men may be a little more aggressive. And the time is changing actually. I remember when Anita Sethi joined me at that time, I mean, she'll put up a sari and apron and all those things, so that she used to say ki many of them feel that women may not be a good surgeon. So should look little more mature actually to have the confidence of the patient you can operate. So I think, but now the things are slowly changing with the more women coming into ophthalmology.
So I have seen, sir, you are right. If there is a male friend sitting with me in the car, he would want me to get off from the steering and would want to drive himself. And I asked one of them, why do you do this? So he said, I feel I'm in a position of power. So that's when I said, why can't I be in a position of power if this driving a car means position of power? Basically the mindset which has to change, and the important interesting thing that she has brought forward is what the patients perceive of doctors as, and we have to also think of how we can change this perception.
Perception will change. I think by nature, men are a little more aggressive. I mean, when the two, if you see the girl born in a family and a boy born in a family, boy will be a little more destructive. He will destroy the toys and will tear the dolls. The girl will be a little more caring from the day one. They are born, and when they will take care of everything, they will take care of the parents, they will hug them, love them, kiss them. So boys will be a little more running around and a little more naughty. So I think that carries on. But of course, so far as the surgical front is concerned, it needs the perceptual change. And I think it's not changing actually very fast. Another 5-10 years time, I think the mindset will change completely.
Yes, Ikeda, we can.
So now I would like to invite Dr. Parul Singh for her talk on women beyond ophthalmology. So we will discuss a positive aspect of this talk and talk about how we can bring each other up. So can I have Dr. Parul, please, for her talk?
Hello. Yeah, am I audible?
Yes.
Okay. So just sharing my screen. It's taking some time.
Doctor, it's not visible. Can you just stop and reshare if possible? Yeah, it's visible. It's visible.
Is it visible?
Yes, all good.
Okay. Thank you. So when we are discussing a lot of problems that women are encountering in ophthalmology, I wanted to make a different note on what women need to do beyond ophthalmology as well. Because we as ophthalmologists have to do so much else than ophthalmology, and we have to deal with women in the society. So I want to just make it a point that there was a recent term called as the new women, which actually came at the end of the 19th century to basically describe women who were pushing against the limits which society imposed on women. So what we need to do is we need to celebrate womanhood. And how do we do that? So first we have to acknowledge that what makes us proud as a woman. So we as women have certain unique characteristics that our male counterparts don't have. So to highlight some of them, one of the most important aspect is multitasking. What women can do as multitaskers, I think it's unique to them. They can manage home, they can manage work, they can manage children, they can manage their social engagements, and so on and so forth. The another thing which women have, which is very uniquely with them, is the mental stability and sustainability to go through difficult life situations and still hold on as an individual and keep on moving forward. The third other thing which I made get to the point is the most important thing women have, which makes them really unique, is the combination of compassion, care, and nurture. The type of compassion, the type of care, and the type of nurturing they do, no wonder Ikeda just made out that more pediatric ophthalmologists are being chosen. And although the data says so that for complicated cases or for general ophthalmology, patients go to men, But my experiences, I have never encountered any gender bias when patients come. I think it is changing, and soon not only patients will acknowledge us for the extra compassion, care, and nurture we give to patients, they will also acknowledge us for our professional uh, commitments. The other thing which women have is the expression of emotion, which is also uniquely granted more to them for their gender. The way women express themselves, maybe love, maybe affection, maybe respect, or all these emotions are so easily they come out from women. Now, the another very important thing is beauty. Beauty is something which women are actually blessed with. So, and today's world, the women are doing so good, and we have all the right, and I think we have all the duty to, to accept this and to keep working towards it and to feel confident of it. The another thing is women have very strong instincts. That's what we say as sixth sense. So women are inherently genetically more intuitive. Their instincts are more strong. They can enhance it. They can use it in their professional as well in their personal relationships. And as we all know, the unique, the blessing to bring power, to bring a new life in this world is a unique power which only women can experience. This is something so powerful, to bring a new life to this world, and this gives us so much confidence. And I think it's so much is being given to our hands, and the another thing is the female bond is so strong. When women support women, actually incredible things happen. Now, what we as women have to do is to make this bond further stronger and keep doing wonderful things. So, what do we have as, when we talk of New Age women, what traits of an authentic, kind, strong New Age women should have? And what we have already, started to begin with, and we have to move forward, that New Age women actually, they do not take things anymore personally, and they do not indulge themselves in judging people. They observe more, they take criticism in a more positive way. They have started to exercise kindness. There's no more blame game, and there is no more that attitude of guilt when women go to work now. They are no more indulging themselves in that typical business of sacrificing themselves. So they have started to make themselves more content and more happy. They have started to use the difficult times as and people as their teachers rather than keep the grudge or to work against them. I don't think they anymore do that. They have started to own their actions. They have started to become more expressive by communicating their need and feelings towards their personal self, to the society, and to their families, and to their workplace. They are no more afraid to stay alone, and the most important is they have started to forgive a lot. They have started to forgive. They have started to move forward. They are more confident about who they are and how, and they're able to love themselves. They're able to give time to themselves. They're able to demand love for themselves. They have strong convictions. At the same time, they're more flexible, more both at the workplaces and at the family level. They have started to admit their mistakes and be they gentle in their dealings. And most importantly, they are comfortable in their own skin and have started to accept and to be contented with who she is. So when we talk about also, there are a little few points which I would like to emphasize on what are the duty of women towards self. The first and most important duty of today's women is to be physically fit. Everything comes later. I think this should be the priority by every woman, to be physically fit. They should be fit. uh, we have to be, really take care of our health, maybe by doing solo fitness regimes, maybe yoga, dancing, walking, running, gymming. And to do it in group of women is a further, it really helps because we motivate each other. Now, besides physical health, social health is really important. People, all people, especially women, they should hang around socially. They should make friends. They should discuss their problems. They should motivate each other in these social groups. And the mental health and emotional health are, of course, very important aspects, and also spiritual health. So besides physical health, mentally, socially, spiritually, spiritual health is a new, it's something which is coming up new, and it really has to play a very important role in lives of all of us. However, whatever we may do on our physical levels, on professional levels, but besides being spiritually healthy, I don't think it works. And once we develop this faith system, we develop this, awakening about being spiritually healthy. It really helps. It makes us wholesome individual, and it helps us not only personally, also professionally. So it's like uh, we have just celebrated Women's Day. So what I always feel is it would be, this change which we are trying to bring, this patriarchal society, it would really end when there will be no need to celebrate the Women's Day. When women will be considered as a person. I mean, why do we need to celebrate two genders, Men's Day, Women's Day? What is the need? So the change will actually come into existence, the change which we are trying to bring by this redressal committee itself, when there will be no need of a redressal committee, when there will be no need of a Women Day to be celebrated individually. So it's more important to becoming a person rather than to become women. So I think it's the concluding slide. So it's more important for women to have self-discovery. We need to have hobbies. We need to travel far, new places, develop new skills. So besides being professionally competent, all this journey into self-discovery is as important to becoming independent, to become confident. We need to develop new hobbies, because there are recent studies and trials where we say that all these aging diseases like Alzheimer's and Parkinson, basically neuronal damage is happening, which leads us to here. So developing these hobbies, developing new skills, as we were used to be, in our childhood, we were learning everything new, and that kept our neuronal health, at a very good level. So we have to keep developing new skills, indulge in our hobbies, and travel new places, so that our neurons are not aging and we continue to be young, more confident, more competent. And we already have few social groups, like we are part of it. Like there's a group called Life Beyond Ophthalmology, where we are talking not just we are not talking about profession, we are talking of life beyond our profession, which is so important. We have a very unique group called Doctor in Sarees, where doctors are post their sari photos and pictures, and that's actually very refreshing. And I really feel that these groups really help us to look beyond our careers. So it's a small quote I really like, which says that "Agar man sambhal gaya to jeevan utsav hai." So it's more about being mentally more awakened, and I think that's it. Thank you very much.
So very important message Dr. Parul has given, and that is that if you are a new age woman, more than half of your personal and professional challenges actually get solved. And the work for AIOS Redressal Committee also becomes less than 50%. So this is one more thing which we will focus on through this committee, how to make you a new age woman. We cannot keep saying that we are being harassed, we are being, we are facing challenges. There are some things that we need to do ourselves to get over these challenges. And after that, if there's any challenge left, then the committee is always there. So we can go on to the next.
So now, thank you, Dr. Parul, for that wonderful talk and such an optimistic point of view on how to manage ourselves. And now I would like to invite Dr. Jimmy Mittal, who's the head of department at Vivekanand Hospital, Lucknow, for her talk on clinical case scenarios, the real world, and what are the different challenges that we face, and what are the women challenges they face, and how to help them, and what are the solutions for them. So Dr. Jimmy Mittal, please.
So just a brief intro about Dr. Jimmy. Dr. Jimmy has been running a project called Project Shakti, which is a project of Women Ophthalmologists Society, and it is dealing again with the workplace challenges. And Dr. Jimmy is very, very passionate about this project, and she is actually helping a lot of women ophthalmologists with this. And also want to share, at one time she herself faced a challenge. Because of this, she actually thought that she should help others too. And at that time, she had approached WAS, and she felt that WAS did not give a good hearing to her. So she actually made us realize that WAS also has this responsibility, that you should be looking after individual challenges. And then we gave her the responsibility that you can represent WAS and you can do this, and she's really doing it well. So we thought that she was a very relevant person to speak here, because she's actually a person who has all these experiences of herself as well as of others, and hence she consented to share certain case scenarios.
So good morning, everyone. Am I audible?
Yes.
So at the outset, I would like to thank Lal sir and Honawar sir and Mohita ma'am, of course, for making me a part of this program. So as ma'am has rightly pointed out, I underwent a certain kind of a professional challenge at my workplace. And I overcame it within a span of 2 years. But then I decided to, yes, that we should have some kind of entity or a society where a person who is facing a workplace challenge can go up to and should not feel alone, basically. So I shall be talking about relevant case scenarios involving workplace challenges. So as Dr. Ikera just shared, that workplace challenges do actually exist. Workplace challenges on a lighter note or harassment actually exist throughout types of workplaces. From simple bullying to outright discrimination, it is important to understand workplace harassment so you can avoid a hostile work environment. So, what are the types of harassment or challenges a woman faces? They can be verbal, psychological, or emotional trauma, but there are also serious forms involved, such as physical and sexual abuse. So, it is important to note that any type of challenge can be overcome by mere talking or discussion, but it is important to note that all types of workplace harassment are illegal in nature and they need to be reported and they have to be solved immediately if a person is actually reporting a workplace harassment at an institution or a hospital. So workplace challenges can be caused either by the employer, the employee, or the co-worker. And not to speak against these challenges enables the situation further. So first and foremost, we need to decide to speak up for ourselves. Take up the issue with your family members. They are your biggest support. Your mentors, your professional seniors. You may also go for a professional help if you actually feel the situation is very grave. You can approach a lawyer or a psychologist, but you have to speak up for yourself. So how do these challenges affect? These challenges not only affect the women employees' productivity at work, they also hamper her comfort level and safety at work. And the long term, it has been seen, it is known to have physical and psychological effects, mental effects, health effects, and in the long term, financial effects if she decides to leave the job. These challenges can also expose an organization to legal liability if the organization does not handle the harassment or a challenge properly. So this is important to understand for any institution or a hospital, that if a worker is coming to them with a problem, they have to listen to the problem and take it seriously. Coming to the case scenarios, the first case scenario would be that if we have having two persons, person A and B are working together on a common project or a thesis for in our case, where both of them have contributed equally. But in the end, person A takes all the credit for the work done. So how should B handle the situation? So in this case, I would rather suggest that the B person stays calm and approaches the management or the project in charge, and maintaining a cordial working environment, he needs to discuss the matter with the in charge and tell how the person has contributed. And you should avoid the glory hawk syndrome. The glory hawk syndrome is basically a syndrome in which despite doing all the work, the juniors are avoided, they're not given the credit, and the seniors or the senior project in charge takes away all the limelight. So we have to avoid it definitely. And first of all, you should not think that I should be quiet and I should let go of the situation. You have to confront the situation. You have to confront the person who is taking the credit for your work. So you have to speak up for yourself. And always document facts and your contribution in written. It has been seen that written documents or written applications do hold a very legal importance also if you have it in records. Second case scenario would be, for example, your colleague or manager, irrespective of gender, being a female or a male, makes uncomfortable passes or comments on you. So how shall you handle the situation? So in this case, first of all, you need to eliminate any kind of fear or guilt or self-pity, because you are not responsible for the other person's behavior towards you. You have to let go of that thought that why is he doing this to me and what is wrong within me? You have to let go of that fear. Secondly, you can talk to the HR department. They have special cells, or in this case, you can approach the Vishakha committee at your setup. So when we were doing a survey at the WAS Project Shakti, we found out that 90% of the female ophthalmologists were unaware of this Vishakha committee at the institution level. So let me be a little bit speaking about Vishakha committee. It is a Vishakha guidelines have been given, and they have to be set up at every institution, being it a government institution or a private institution. And this basically works on any kind of gender inequality cases or sexual harassment cases. And it is mandatory for every hospital to have a Vishakha committee at their setup. So the person can approach the Vishakha committee in this particular situation. The case scenario 3 would be that, for example, at request of your manager, you have helped them with a personal errand. Slowly, the manager starts exploiting you in making all the errands for personal purposes because you have all the resources to help him. How shall you confront the situation? So in this case, first of all, you have to understand that you have no obligation to get exploited by the senior just because he's your senior or he's your boss. You have to again put your foot down and tell him that, sir, once I helped you, but it is not possible to help you again and again and go out of the way and get your job done. Secondly, tell the higher authorities and get the matter sorted officially. And the most important thing is bring this matter on record, because this person has done this to you. Maybe he has a tendency to do it with some other colleague of yours. So you have to make sure that everything which you are approaching and telling the authorities, you have it on record in written. Because verbal communication does not hold much of significance. So you have to bring all the matters of workplace challenges in written if possible. The fourth case scenario would be the workplace bullying. In this, it was seeing that if you have a weak leader or a weak head of the department, for example, and he's unable to handle the pressure of a situation, so eventually he verbally abuses and unduly pressurizes his team members or the juniors into completing the task. And once the task has been completed, he takes all the glory. So how will you handle such a leader? So in this case, again, you have to put your foot down, you have to speak up for yourself, report and request for a team change if possible, and if possible, go to a place where you are valued and your contribution is actually acknowledged. So again, you have to help yourself, only then other people come forward to help you. So case discussion 5, this is very interesting situation, because when we did the survey in Project Shakti at WAS, 90% of the female ophthalmologists were facing this kind of a scenario. So this situation is a situation in which a wedge was created amongst the colleagues due to the team leader showing workplace favoritism. For example, if a senior male colleague is seeing you as a threat because you are doing extremely well in your professional career and you have more patients than him in your OPD or surgery, then he starts giving more preference to your junior male colleague. Can give more opportunities, more academic opportunities, more surgical opportunities, maybe divert your patients. This all keeps on happening in a very subtle way, but you have to keep your eyes open and you have to see what is actually going on, because ultimately it is causing a lot of mental pressure, financial loss to you, and also creating a toxic work environment. So in this case, what would you do? Again, you have to speak up. You have to keep your eyes and ears open as to how is he able to do it. Again, document incidents showing the favoritism part on the why is your senior doing it? What are the causes? What is the reason behind it? And definitely talk to the higher authorities of your hospital, the HR or the management, and get this matter sorted. So to brief as to how to approach or report a workplace challenge or a harassment, there are a few tips I would like to share, because I have been a part of this program. First of all, decide to speak up for yourself. Take up the issue with your family members, your mentors, your professional seniors, professional female and the male ophthalmologists who are your friends and your, well-wishers. Talk to the lawyer if it is a grave situation, or a psychologist if you really are dealing with a mental and emotional breakdown. Secondly, be firm and specific with your approach. Remember, an employee might just come to you and complain vaguely, for example, about unprofessional conduct or inappropriate behavior. Please ask the employee or your colleague to describe the conduct more specifically. It cannot be a vague complaint. It has to be more specific. Specificity in the form of the fact that we have to have detailed records of each indiscretion that has been happening to you. For example, the people who were involved, what was said in the situation or done in the situation, where and when the abuse had occurred to you. Document each incident in detail to bring it on record. Record the time, date, and place where the incident had occurred, preferably through emails and written applications for a long-term record value. Share with the authorities, your colleagues, the HR committee, the Vishakha committee at your hospital, Women Ophthalmic Society, and now, of course, we have the AIOS Redressal Committee, which is open to you. You should not feel alone in your professional journey. We are here to talk about it and, of course, find a solution for it if possible. And evaluate your workplace policies at least once a year to see that they're updated for your safety at work. So this was what to do, what not to do, these three most important points, because doing this, these mistakes could actually serve to escalate the situation. So what should you not do in such a situation? First of all, do not ever retaliate or confront your senior, because he might just blame it to you that you are misbehaving with me. So retaliation can escalate this issue and will often makes the matter worse or complicated. Instead, escalate the issue properly and let your HR professionals handle things from there. Secondly, do not complain to your co-workers, because your colleagues have not much power to do anything in the department. Maybe they're not even interested in listening to your problems. And thirdly, they will likely to water down your version of the events if they're called to testify. So if they're called to testify against a senior, they might just back down and say, no, it is not possible ki sir aisa kare. So it is like they might not come forward when you're actually requiring them to do. The third most important point, again, is do not keep quiet. You should always report any kind of workplace challenge or harassment, and you should never feel lonely. And all the complaints, if they're coming to you as an in charge, should be thoroughly investigated. So remember, all of us deserve a safe workplace. And to deal with these workplace challenges, Team WAS came up with the novel idea of Project Shakti, as Mohita ma'am has just shared with you. So it's time to tap into your Shaktitva, because you need to stand up against workplace challenges and report harassment as soon as possible, because you need to stand up for your mental and emotional health. Thank you so much for your patient hearing.
Thank you, ma'am, for that wonderful and insightful talk, and very interesting to hear the different clinical case scenarios and how to take care of them. I would like to ask the AIOS office bearers, Dr. Harbans Lal, Dr. Santosh Honavar, and Dr. Samar Basak, if there's something AIOS can do to make the Vishakha committee a little stronger and to make women aware of such a provision that is present in various institutions, because I think, like ma'am rightly pointed out, that 90% of women are not even aware that something like this exists, that there is a committee which should be available at the institution and they can go to and discuss their problems with. So I think the first step towards remedying anything is awareness about where to go, because most of the women would be lost on how to approach, whom to approach, where to go, how to escalate it in the right way. So, that I think that is something important that maybe we can think about.
So I think that is what is the responsibility of this committee actually. So this is your responsibility, that to spread the awareness, because the AIOS office bearers will have many things in hand. So this is the reason we form the committee. Otherwise, the office bearers can do everything themselves. But we know that we are not able to carry out all the duties what are required from us. So we form various committees so that they can take our work forward. So though this committee started working little late and we took little time to form this committee. So but I think now it is on the right track. And so whatever matter this committee prepares, it will circulate to all the members of the country. That is the job of the AIOS, to circulate whatever matter you give it to us, but you take it forward.
So here, sir, I would also like to talk about one project of the government, which is called Gati project. This is from DST. This is called Gender Advancement for Transforming Institutions. This is something which they have taken from UK, and where most of the good institutions they participate in this project, where they first give a questionnaire to understand what the main aim is: equal opportunities and good working environment for women apart from men. So they try to find out what the situation is and what the particular institution has done for women to make the environment good, as well as safe, as well as something which promotes them. And when they understand what is the situation, there is the Gati team will actually help in bringing about changes with an action plan as per a particular institution. And based on what the Gati score is, the institutions are being given a scoring. So in fact, the government projects will now in future go to those institutions where the scoring is good. as far as Gati is concerned. So this will be one of their criteria, something like NABH, like your environment should be good for women to work apart from men. So maybe something like that can also be thought about, especially for institutions, and whichever are the willing institutions, they could be taken as a pilot, and something like this could be worked out. So what's your opinion, Dr. Basak and Dr. Harbanslal and Dr. Santosh?
So I think, sometimes back we had the smokers' right. I mean, people, I used to smoke even in the aeroplane, in the picture hall, in the shops, person next to me sitting. So now it is a totally non-smoker's right. I mean, anybody smoking now feel guilty if he is smoking in a public place. He has to hide. And once we started Swachh Bharat, anybody throwing the chilka from the car, if somebody watches, you feel ashamed of yourself. So the movement and the buzz has to be created by our society. That this is what, and then people will start falling into the place. That means if you make people aware, this is what about all these programs and other things, then slowly and slowly, like any BHB, I mean, the people were asking for us to get the recession done, we will never do it. Why I need to do it now? Once it has become so important that we automatically follow it. So I think once you start creating and talking about it, creating a buzz about it, I think the institutions, now if somebody comes and tells me, okay, do this, I said, forget about it. I don't need it. So I think we need to create a little more atmosphere for this. And then it will take 2-3 years time. But if you keep on following and keep on bombarding, if you do this, you'll get this advantage, do this, this is that advantage. Any female joining your place will feel safe. I mean, you have got to really create, and this is again, the ball is in your court, how you plan. And anytime you feel to enlarge and involve more people, will be more than happy to do that. I mean, if you feel that your team is not adequate, somebody will be forming our team on 24th of May. He is coming to Delhi. So he will relook into the committees, and if you have got any suggestions, you can forward it to him. Yeah, Samar? Samar, you want to say something? Unmute yourself.
He's muted.
Samar, unmute yourself.
Muted. You're muted, sir.
Samar, unmute yourself.
Yes. So spreading up this knowledge, even first time I know this Vishaka committee, I mean, kind of thing, and whether it is applicable for any institution, government, public, private, NGO, we do not have any ideas actually. So the knowledge has to be percolated each institution, and of course the HR head will then implicate in their institute. Then the members or doctors, not only for the doctors or other staffs, this is also equally important. The female paramedics, female other staff, this is also important. So this awareness has to be created among us, and I think this is the right forum. And over the period of time, we should get into the picture that Vishakha committee should be. So if this committee is there in the institute or in any private sector or a government sector, so that is the first area to communicate. So that things will happen.
Okay.
So even while I was making this presentation, this Shakha committee and the guidelines need to be acted, and they have to be followed even by schools, and parents can report any kind of harassment in your institution if it is happening through some doctor or some kind of nurses. Even everybody is covered under this act. Not only females, but any other person visiting the premises is liable to make a complaint against it. So it is a very beautifully done, sir, act, which needs to be implemented in all the institutions.
All the institutions.
Yes, sir. Government as well as private.
Yeah.
So now moving forward, I would like to invite Dr. Aarti Anand, who's a senior clinical psychologist who's been working in Sir Gangaram Hospital and has an experience of more than 25 years. And she will talk to us about step-by-step solutions for better performance and how to provide psychological support to women.
Aarti, we are not able to hear you.
Ma'am, please unmute yourself. We can't hear you.
Sorry, can you see my screen?
Yeah.
Yes.
Good morning, everybody. I would like to thank Dr. Harbans Lal sir for giving me the opportunity to be part of this program. I'll be talking about sexual harassment in workplace, step-by-step solutions for better performance, psychological support. Okay. Impact of sexual harassment on women in workplace. One of the most prevalent mental health outcomes of sexual harassment is post-traumatic stress disorder, which involves experiencing intrusive memories, flashbacks, nightmares, and emotional distress triggered by reminders of traumatic event. It also involves depression, anxiety, fear, and insomnia. Many of these victims blame themselves, have guilt feelings, and negative self-esteem. These are the emotional impact of women who are harassed in the uh, workplace or are in continuous conflict with with the senior or with the people who are harassing her. The chronic stress and anxiety resulting from the experience can lead to high blood pressure, cardiovascular problems, and other physical ailments such as headaches, stomach ailments, pains, aches in the body, and alcohol and drug abuse. The social impact is also seen in victims who are facing sexual abuse. In case in case the victim complains of sexual harassment, then the danger of retaliation from the harasser or colleagues is there. They withdraw from friends socially and mentally. They can be subjected to criticism, blame, and humiliation. Defamation of character. When the problem comes on in the open, the family, friends, colleagues, and they distance themselves from the women. Demotivated workflow force involves hostile environment. There is increased absenteeism, decreased job satisfaction, and reduced work productivity. Now, how a psychologist can help and give psychological support. There are different ways. Emotional support. This can be given by psychologists, uh, who can provide a safe and confidential space for women to express their emotions and experience related to harassment. For example, they may use techniques such as listening, empathy, validation to help women feel heard and understood. Research has shown that victims of workplace harassment reported decreased psychological distress and improved well-being after receiving emotional support and mental health support from mental health professionals. Then there is realization and acceptance of the situation. The first reaction towards sexual harassment can be feeling numb and disbelief. Many try to stay in a denial mode about what happened. The most effective way to recover from trauma of sexual assault is to acknowledge it to oneself. Counselors can help the individual come to terms with reality and reinforce the belief that it was not their fault and they were not part of the problem. Then psychoeducation, it is another very important role it plays. It is a procedure in which the client is educated about her condition, its causal factors, and its management. The client is informed about the course of counseling sessions along with therapist's role and the effectiveness of client's cooperation. The client can be told about the statistical number of girls who were being harassed sexually in our country to let her know that there is other people too, and she is not the odd one out. Now, the next one is addressing the barriers. It is essential to acknowledge and address the barriers that they may prevent survivors from help, such as stigma, shame, fear of judgment. Breaking down these barriers and fostering a supportive environment, encouraging victims to reach out for the service they deserve is essential. Then comes cognitive behavior therapy. This is another very important way of helping women who are in distress. Psychologists employ CBT techniques to help women challenge and reframe negative thought patterns related to the harassment. For example, they may use cognitive restructuring beliefs and self-blame to help or feelings of worthlessness. Research has shown that cognitive behavior therapy helps in symptoms of depression and anxiety among survivors of work harassment. Another way of cognitive behavior therapy is distraction techniques. These techniques can be used both to reduce fear arousal and control intrusive memories. Involvement in more organic activities such as art, crafts, and other creative activities will be most helpful in that they require person's full attention, which is helpful in neutralizing unhelpful thoughts. Then assertiveness training. This can be done through you can provide, psychologists can provide skills training to help women assert their boundaries and communicate effectively in the workplace. This may involve role playing, assertiveness exercises, and communication skills training. Research has found that assertiveness training led to increased self-esteem and decreased psychological distress among women who experienced workplace sexual harassment. Developing healthy and coping strategies. Some victims may try to look normal as a way of coping. While this coping mechanism may work in the surface level, the individual may experience mental breakdown eventually. Other unhealthy coping mechanisms are alcohol and drug abuse. Counseling can help people develop healthy coping strategy. Advocacy and empowerment. Psychologists can advocate for women's rights and provide resource for organization and community support. They may collaborate with lawyers, human resource professionals, and community organizations to ensure that women have access to the assistance they need. Education and prevention. Psychologists can contribute to workplace training and policy development aimed at preventing harassment and promoting respectful behavior. They may design and deliver workshops and topics such as bystander intervention, conflict resolution, and diversity and inclusion. Then they can be taught certain self-care practices like relaxation exercises, yoga, motivation to socialize and fostering supporting environment, journaling their feelings and thoughts, diet, having a regular diet, keeping a regular sleep, and having physical exercises regularly. reduction in nicotine and caffeine. These are few ways of taking care of women who are in trouble. By integrating these approaches, psychologists can play a pivotal role in supporting women who have faced workplace harassment and advocating for systematic change to create safer and more equitable work environment. Thank you.
Thank you, ma'am, for that very insightful talk and giving women ophthalmologists relevant tips on how to overcome these challenges and what effect harassment actually has psychologically on women, and how important it is to rehabilitate them and motivate them and help them in a way that their mental health can become better over a period of time.
Thank you.
So now, if the panelists would like to pose any questions, or we could have a discussion regarding this topic, if there are any questions that we could discuss, since we are through with the different presentations and different aspects of the Women Redressal Committee.
I think if there are no questions, then only thing is once again, I'll request this committee to be actively get involved into and keep on posting and keep on making people aware that this committee exists and what are their rights, and about the other projects of Great Vishakha, all those things they should be aware of. And once the people get sensitized, I think we'll move forward, and will take a year or two before our what the vision we have for this committee, we can achieve that. And at the same time, the AIOS will be more than 100% willing to take up any responsibilities on behalf of all the women's ophthalmology in the country. So with that note, I'll say thank you all of you for participating and sparing your time. And please keep on posting your messages and involve and with the women ophthalmology, which is becoming very active, not only nationally, but internationally also. So keep on posting all those things in your WhatsApp group also. Besides using our AIOS portal, we have got also all the ophthalmologists WhatsApp group available with us. We can send by WhatsApp. We can send the mailers. So we'll be doing a bit of our end things. And I request all of you to really take it forward in a much bigger way and give it a really boost and make it popular all over the country. Thank you. And somebody want to say something?
No. I'll take it forward.
Okay. Santosh
That's one line that is good enough. Yeah.
Okay. Thank you, Baba. Everybody. Mohita, you want to say anything?
Sir. Thank you.
We could have a photograph if everybody can switch on their videos. Dr. Santosh.
Sunil, Zoom team.
This is the first webinar, and we have a lot of work to do as per what Dr. Harbans Lal has assigned on us. So
where to go?
We'll take it forwards definitely. So I've taken a photograph.
Okay.
Thank you, everybody.
Okay, thank you. Bye.
Thank you so well.
Thank you.
And thank you so much.
Thank you, sir.
Okay.
Bye.
Bye.
Bye.